Hi there, this is Dr. Belitz, and welcome to the Ask Dr. Jack show. Here's where we answer the questions that you ask. Today's topic: did you know that there is a potential connection between dementia and autism? I know, it's crazy. Autism usually noticed in the younger kids, dementia usually noticed in the elderly. They have found something that actually connects the two. So, what is it? Well, what they found was that there was a decrease in the level of vitamin B12 in the brain in both cases. This was figured out at Nova Southwestern University, and basically what they found was that what they believe is that the deficits could contribute to the neurological or neuropsychiatric symptoms associated with autism, schizophrenia, or age-related dementia. So here's the problem: is especially for the elderly, it's hard sometimes to get a medical doctor to prescribe a B12 shot. You might be thinking, why? Well, because most of the time they will do a blood test and the vitamin B12 will be within normal range. However, blood levels do not predict brain levels of vitamin B12. And that's where you need it. You need it in the brain. Now, you can't take a vitamin B12 supplement and actually have it really be effective because your body can't absorb B12 efficiently and fast enough for it to be of any good. So it has to be given as a shot. So if you have a loved one who's at a long-term care facility, you have got a 45% chance that this person is needing or has a vitamin B12 deficiency, needs vitamin B12. So it's a really good thing to get them and you could do a trial injection of vitamin B12 and just see if they respond. And if they respond a little differently, make sure that that's noted on their chart so that the medical doctor doesn't care so much about the stupid blood amounts of B12 and realizes that even though the blood amount was normal, they saw some benefit from the shot, because that's the most important thing they're going to look at. If you have a kid who is dealing with autistic related disorders, schizophrenia or something like that, make sure that you look into the vitamin B12 for them also. The great thing about it is it can't hurt you. I don't understand what the issue is, why it is so hard to get this across, but so many people have such a tough time of getting these things done to their loved ones. So make good friends with a medical doctor that can prescribe a B12 shot, and you might see some beautiful changes in your loved one. Okay, that's it for this episode of the Ask Dr. Jack show. I am, of course, Dr. Jack Belitz, a chiropractor in Omaha, Nebraska. I'm not here giving medical advice. I'm here passing along information that you can use to make your life better, especially with this case. We're talking about vitamins. No medicine whatsoever required. So how cool is that? All right. Hope you have a very beautiful day. If you have a question that you would like me to research for you, ask Dr. Jack B, that's BEE @gmail.com, or give the office a call, 402-333-4848. If you have a child dealing with autism, we are doing amazing things with those kids right now. Have them come in. Let's do some testing on them. See if they qualify for the type of care that we are able to administer here. We might be able to make your life and their lives a lot easier, higher quality of life, however you want to say it. There's some really awesome things happening with those type of diagnoses right now. So 402-333-4848, and I look forward to seeing you on the next episode.